Ladies and gentlemen, welcome back to another episode of the Working in Hockey podcast. I'm your host, Nick Bowens, and today I'm super excited to be joined by Dr. Alicia Naser, a Board Certified Behavior Analyst who specializes in behavioral sports psychology. It's a mouthful, but I can't wait to get into it. This has to be one of the roles that I get asked most about. So, Dr. Naser, how are you today? And thanks for taking the time here.
Well, thank you for having me a year later. Nick reached out for the listener. Nick reached out like a year ago, and I was like, come back and ask me like in the off season. And here we are now, even though it's not off season yet.
Yes.
So I'm happy to be here. And like you said, it's one of the things, the second most frequent thing I get asked about is how can students or people looking to do what I'm doing, even if they're retired players or retired coaches and want to go into this space, like how can they do what I do? How did I get to where I am? And then coaches and agents and players wanting to know, like, what's your background? How is it that you're working with hockey players? So this is really important to me for that reason, because like you, I get asked about it so much. And I think we both decided, I was like, hey, can I just lay out everything? And we both have one place to send people to listen to be like, this is my story, and take that and do with it what you will. So thank you for having me.
Absolutely. No, my pleasure. And like you said, we're going to get into everything here, from the journey, the timeline, the educational components, what you're up to today. But started off super easy. For those who don't know, what is a board certified behavior analyst? What do you do day to day? What's life like right now for Alicia?
So my life as a BCBA, it's short for a Board Certified Behavior Analyst, is much different than most. Most generally work with individuals with autism or neurodevelopmental disabilities. There are many who work in health and fitness and sports, just not necessarily the NHL specifically, nor pro athletes. I believe, so far as I know, we're still on the hunt for anybody else who's a BCBA who works with pro athletes, but I've been told that I'm the first.
Cool.
So that's very exciting. It's very exciting for the field. It's very exciting for sport, because we have a lot of, to answer the question about what is a BCBA and what do we do, we change behavior in the direction that we want it to go. Either we replace behavior, we increase it, decrease it, depending upon what that behavior is. And it has a lot to do with the variables, or not a lot, but everything to do with the variables in the environment and their relationship to behavior. So it's really about manipulating the environment, the variables in the environment, to essentially produce, if you will, for lack of better words, the behavior that we want. So that is what, as a BCBA, that's our job, but the behavior that we apply that to is dependent upon the population of the individuals we work with.
Sure.
So in autism, it might be like self-injurious behavior, aggressive behavior, repetitive behaviors, stimming, things like that. In health and fitness, it might be maybe a certain strength and conditioning skill. It could be walking. It could there's a whole host. Anything that's behavior, we can do something if we specialize in that area to change that behavior depending upon the need. My day-to-day is different from what it used to be for many years. We'll get into this, but 10 plus years before, working with individuals with autism and neurodevelopmental disabilities. So currently, now that I work with NHL players and junior hockey players, my day-to-day has to do with consulting with coaches of NHL teams and OHL teams, consulting with coaches and scouts and agents, teaching them how to teach their players and coach, maybe change up their coaching tactics a bit based on principles of behavior analysis. And then I'm in session with clients, and then I'm creating content, which I never thought that would be part of my job description. That really hit the ego a little. And then it humbled me. I was like, oh, this is part of the job now in 2024 and 2025 is I'm a content creator now. So that's part of it. So,
well, it's going well. It's going well on the content front. I mean, like you said, that's how I first stumbled across what you're doing. And, I think when I initially found you, I assumed it was only players. It's been interesting to learn that it is coaches, staff, agents, etc. as
and
well.
Referees.
Everybody. I think that's super cool, but also completely makes sense, because who's under more scrutiny than them, I guess. But I mean, we're 3-4 minutes in here, and your passion for this is evident. Where did that passion come from? How did you first get interested in the world of behavior analysis? How did you decide to go to school for this? Take me all the way back here to a young Alicia.
Okay, so it's going to be a little long. So for the listener, just prepare. But it's important, and I was telling this before. We were talking about how this part is important, because to understand where I am now and want to understand what I'm doing, it's really important to understand the history. Like with any behavior, it's important to understand the history of reinforcement or the history of interaction with one's environment, right? So it might seem a little mundane and boring, but it's really important to the context and also why I've been effective in what I'm able to do and work with players. So my brother Nassar, he is the coolest guy ever. He is much cooler than all of us. He
Correct.
is, and he correct, and he always will be. And as much as we try, we just will never be as cool as him. But my brother Nassar, he is 2 years older than me. He was born in '88, and he was diagnosed with autism. And back then, there were not the resources that they have now for autism, or the understanding, or the acceptance even. And he now, I post him on Instagram and stuff, and everybody loves him. It's crazy. And what you see now with him on Instagram is, when we speak about autism, we'd say like higher functioning, right? So he's higher functioning, but back then it was not always like that. He was nonverbal for many years. He was engaged in self-injurious behavior, was pretty severe, and it was for a very long time. We weren't even sure, like, he wasn't even really supposed to live, actually. He was born premature. There was just so many complications. And of course, he's 2 years older than me. So growing up, it's all I've known.
Yeah.
And I think as a sibling with somebody with autism, you grow up with a different understanding of human beings. You grow up with a different ability, I think, to relate to people, and a level of empathy and compassion, perhaps, or just understanding and patience. I don't have that same patience I have with him with everybody, but and that's not to say that somebody without a sibling with autism can't have those traits or characteristics. They definitely do. There's many people in the world who do, but it's just something about it is different. I can't really explain it, and so because of that, there was always this. It seemed like it could be no other way than for me to go and to help people with disabilities, right? So, do you want me to take you through the timeline of like school? Okay. So, cause that's probably the next segue is, my passion for helping people started with my brother. Okay. And then, there's this saying in psychology that, research is me search. So we're all kind of like trying to figure out why we do what we do. Yep. That didn't come till later. I wish it kind of came sooner than it did, but whatever, I'm here now. It is what it is. And so, I went on this, let me just take it starting back to high school, because I think it's important for people who might feel maybe hopeless or confused, or like not knowing what their next step might be, or being like, I don't have these qualities or characteristics, so therefore I shouldn't even try on this path. I know what that's like, because in high school, like I barely even like almost graduated, I think. Like I tried to think back to remember it, and I was somebody who was just like, C's get degrees, like that was my motto, because I was just not smart. Like I think it's that I didn't know how to study. I didn't, conventional education doesn't really set us up for individualized understanding of how to learn, right? Yes, it's just does not. And so it really does a disservice to the learning process. And so I needed definitely extra attention and a different environment to learn in that I didn't have. I didn't know it at that time, but looking back now, there was definitely like some learning difficulties that could have been addressed, right? So the reason why that's problematic is, number one, I'm Middle Eastern, so I'm Palestinian, and us Palestinians are very, we are a smart bunch of people who go on to become doctors and lawyers. And so my entire family, it was expected of me to become a doctor. Right. And I'm like, am I allowed to swear on this podcast a little bit? Go for it. Yeah. Okay. So I was like, shit, like this is not, I'm like, all my cousins, everyone went on to medical school. And so graduating high school, I'm like, I can't be friggin' pre-med. Like, I'm not smart. Like, this is not, I'll never make it. Like, right. And so I just tried and like pretended I could. And it was really tough. And I wanted to do it, but it was more so I wanted to do it because as a Palestinian, American, your family is expecting you to become a doctor. And so I just felt like this is really, this is not who I am. Everybody, my cousins, it all came naturally to them. So, I graduated high school, and went to, went on to college, But even then I struggled significantly because I started as pre-med. I was like, let me just try. Like I tried to force
Yep.
it. It was not great.
It's
It
a
wasn't,
tough one to force.
yeah, exactly. And like I was not doing well. Like I didn't do well at all. I was there were classes I had failed. And I think that I get this a lot. A lot of people would DM me, even to this day. I even get players, like retired players, who will DM me, or parents or coaches that will say, when I share bits and pieces about my story, they'll say, like, I never would have expected that. Like, it just seems like because you're a doctor now and you're successful, that I never would have expected you had difficulty. And so the reason why I'm highlighting this and pointing it out is because, like, I felt so shitty about myself for so long. Because I was like, first of all, I'm not smart. Number two, like, what am I going to do? Right. I just, and then I was like, my brother can't go to school. I'm the only child in my family, like immediate family, that can get a degree.
Yep.
And I'm like worthless now. Like, I don't know what to do. Like, I felt like nobody was proud of me, because it was like, you just felt like nobody in the family was proud unless you became a doctor or a lawyer, because that's what everybody in our family did.
Sure.
And so, again, I say that because I think part of why, what got me here is like this, like, I have to make it. I have to figure it out. Right. So going back to like school. So I graduated high school, started college, and I was trying to be pre-med. It wasn't working. I was failing classes. And I was like very lost too. I was like, I don't know what to do. And I remember I transferred. Before we got on the call, for like the past 2 days, I was trying to like piece together the timeline.
Yeah.
And I was just like, man, it was all a blur. Like, also I was like having a lot of fun to it. Not a lot of fun, but college parties. So like, I don't remember everything. So, then I transferred from University of Michigan to Eastern Michigan to then try to pursue speech pathology. Now, I'm sure you mentioned your sister is in a similar field, and your mom, so they'll know what a speech pathology is.
Yep.
And speech pathologists work with individuals with disabilities or people who have had strokes, and there's a whole array of populations of individuals who need speech pathologists.
Sure.
Now, this was before BCBAs were relevant. Like, there were very few, and also very few programs. Like, no one really knew who we were as much as people do now. So I didn't even know about ABA, Applied Behavior Analysis, back then. Okay. So I transferred, and I was like, let me try speech pathology. And I transferred to Eastern. And I started to do better because it was less pre-med classes. So I'm like, okay, maybe there's some hope here for me. And then I could also at the same time work with individuals with autism. So I was working in clinics for many years as I was going through undergrad. So then I finished undergrad and I did really well. And so that just goes to show, like, if you find something that, first of all, is not as hard as pre-med, but also like, my instructors, my professors were very reinforcing for me. They saw something in me, and they were like, you have a knack for this. So, they spent a lot of time with me. And college is different than high school. High school, it's very standardized. College, you can choose how you study. You can choose when you study, for the most part, right? Yep. And so I was able to learn more about myself in terms of what I needed to learn, and then also to get the help and resources. Like, I loaded up on tutors. Like, it was really rough for me, but I got through it. And so then I finished undergrad in speech pathology, and I went on to do my master's in speech pathology, because I was like, well, if I'm not going to be a doctor, I don't want to feel like the complete disappointment in the family. So let me go get a master's, right?
Yep.
So I applied. This is how bad it was. This is how not smart I was. And I had to like work my ass off. Like, there's some people that are just naturally smart, and it comes, and then there's some who like just no. And that was me. Yep. It was so rough that I applied to a bunch of schools to go to school for my master's in speech pathology. And the main one I applied to was Nova Southeastern in Davie, Florida, because they did not require for you to take the ACT at that time. I believe it was the SAT. Now I know it's different. I don't even know. But then it was like you out of state, you had to take the SAT. Oh yeah, you're Canadian. You
Yeah, I know
think it's
nothing.
different.
Yeah.
Yeah. So I think, you had to take the ACT for in state and then SAT for out of state. Doesn't matter. But basically they didn't require for you to take that. And I was like, thank God, because I suck at standardized tests. I will not pass. I won't get a good score, and it'll affect, my ability to get in. So of course they were the one school that accepted me. So I moved down to Florida and I started a master's in speech pathology. And this was like around 2012, 2013. And I started off doing well, and then I didn't. It was at a time in my life where I was just very like lost in a way. And I want to remind you, like how I mentioned before, all of the stuff we see on social media now about like learning about yourself and therapy and self-help and understanding like behaviors that you engage in that might be self-sabotaging and, not wanting. Okay, none of that shit was around that.
That's new.
It's new. It's in the past, I would say 4 years.
Yep.
Okay.
Since COVID, roughly, right?
Exactly. And so I was really not my best self at all. Like I was just not a great person. I wasn't a bad person, but there were a lot of parts of me that I needed to work on. And I didn't know at that time. I was much younger. It was 2012, right? So it was a long time ago. I had a lot of growing up to do. I had a lot of learning to do, maturing emotionally, and just in all the ways I had a lot to learn. And, the family trauma stuff, the things that everyone, like it was pretty deep for me. It was pretty deep. And I didn't know any of that at the time. And so because of that, like, I won't get into too many specifics right now, maybe in another podcast on my own podcast where I'll just talk. And, it was a really tough time. And because of that, there were many things, just like I did that I wasn't proud of, including, wasting time too, not studying and not understanding the moment. I just really didn't have any perception and understanding of like what to do with my life, like in terms of like being disciplined. I cared more about like being in the scene, right? And just and it's fine. It's fine to want to, be very social. I was cared more too much about just being social and being around people and sometimes going about that in the wrong ways, right? And I did all this like work on working on all that part of myself and just forgiving myself for all the things I didn't know then that I know now, because that matters to also for my clients right now is like you can only teach people as far as you can teach yourself. So this part is important, right?
Yep.
And so honestly, 2012, 2013, I went through a huge bout of, I would say, depression. I didn't know it at the time, but it was definitely, so things are kind of foggy. My grandmother passed away, and she was one of the most important people to me. And she passed away in 2013, and then I failed some classes, and I failed more, and they academically dismissed me. And so, yes. And so this is where like a lot of people, I don't think would ever know that, and they wouldn't assume it because they're like, oh, she's a doctor. I'm like, I like barely made it out of college, was like, C's get degrees. I got academically dismissed. Like could not take a standardized test to save my life. Like things were not all rainbows and roses, right? It was really very much a struggle. And I think it's important for people to know that that's okay. You just have to figure out a way that works for you.
Yes.
And you have to do it with dignity too. And you have to do it in a way where you're being your best self. So I digress. We're going to get back to that in a bit. But so 2012, 2013, she passed away. I was down in Nova. I remember I was working at the Lululemon there too while I was going to school. And I remember I got the call when I was at work at Lululemon, and it like broke me. It broke me. And from there, a lot of other things kind of just didn't go well for me in my life, mostly because of my wrongdoing. And I then so they academically dismissed me, but I don't really remember the timeline, but I feel like I remember you could request for them to allow you to get back, back in,
Sure,
like
sure.
and provide. And they didn't. They were like, no, we're done with you. I was like, I'm done with me too. I don't blame you, honestly. And so, and you know what? It was better. Like it was just better. So then I moved back home to Michigan. And then I transferred. I think the academic dismissal came after, because I transferred, I remember, when she passed away, back home to Michigan.
Okay.
And I did the online part of the program. But then even there, like, I started failing. So I think that's when I was academically dismissed. And then they wouldn't let me back in because I had failed more classes. And it was really like failing because I felt lost in life. She had passed away. I was very depressed. Like, I also just wasn't studying. I didn't have good study habits. There was just a lot happening, right? So all this was going on. And then this is where ABA comes in and what I do now with behavior analysis. So now we're getting to like the good, hopeful part where shit doesn't always hit the fan,
Yes, we're working our way back up.
Yeah, it did not feel like that. but we were. So then I was like, crap, like, and I remember at that point too, I just want to say, like, I felt like such a failure because I was supposed to be a doctor, and then here I was, like, getting academically dismissed. And it was, again, a long time ago. So I've learned a lot, and I really haven't talked about it in so long because it just seems like another lifetime. Like,
So
it
long
seems,
ago, yeah.
yeah, and it just seems like it seems, truthfully, Nick, it seems like a whole nother part of me that's not even me now. Like, the things that happened, the things I went through, it's just like a whole nother, like a lifetime ago. And all of it around education.
Right.
So getting to your question, what we'll elaborate on later about experience in education and all of that. The main focus really was always around school and identifying myself with school and the degrees I earned. And, the reason why that's also important too for me to have an understanding of now is because for the players I work with, how they identify themselves based on point production, right?
Yep.
Or where they were, I'm sorry, excuse me, what round they were drafted, what pick
100%.
they were. I'm like, this is not, it's very hard to not let it define you.
Yep.
But when it's something that, especially for the players I work with, like, it's all they know is hockey, hockey, hockey. For all I knew was like education, education, education. Because like what my father and my grandfather, like, all they cared about. It's hard to not do that. And so I think, I'm digressing here for a second, but it's important to know that the hell that I went through, that again was partially brought upon myself because of just being immature and young. It allows me to relate to players and the things that they go through, and this understanding of, like, I get that your success and how you define yourself and your value, how you're tying your identity to these things. Like, I understand it, right? And they don't want somebody to tell them to not do that. They just want somebody to understand. And they want to say, like, I understand what you mean, right?
100%.
So going back really quickly, we're almost done here with the timeline a little bit, but basically I was academically dismissed, and I was like, shit, what am I going to do? I need to find something. I did not know what to do. And I had no idea what to do. Oh my gosh, thinking about it. So I remember I don't remember why I decided this was the move, but I remember I went to Wayne State here in Michigan, Wayne State University, downtown Michigan, or downtown Detroit. And I spoke with an academic counselor there. Never in my life did I think, after all those years going to undergrad and then a master's. And by the way, really quickly, in 2012, I did do a stint through Michigan State University, and I studied abroad in London. So in 2012, I lived in London. It was when the Olympics were going on, which is why I remember that part of the timeline. And even then, like, I was like dating this guy, and I was young, and it was like the first guy that I ever like really dated, right? So I wasn't giving school and that experience the attention and the value it deserved. And because of that, like, I just academically didn't do well. So things in school, like for school, were not going well for me, clearly. So then when I went to downtown Detroit to Wayne State University, I remember I set up a meeting with academic counsel randomly. I felt so like, I'm embarrassed. I'm here. Like, what? She's like, who is this person? Like, I didn't even know what was going on. And I was like, I told her the situation, and I said, I was going to go to school to become a speech pathologist. I went to go get my master's. I was academically dismissed, and now I don't know what to do, and I need to do something. And also, by the way, not to mention all the time and money had spent on education so far, that it was all going to go to waste because I had gotten academically dismissed. So I was like, is there any program that will like take me and also apply some of my credits, like,
Yep.
And so she said, I remember she goes, well, there's this new program called Apply. It was I'm sorry, excuse me. It was a master's in educational psychology with a verified course sequence in applied behavior analysis. And so she goes, the head of this program her name is Krista Clancy, Dr. Krista Clancy. And Krista, who is one of my biggest mentors, I haven't talked to her in a little while, but one of the people that I will always thank for where I am. She's like, this is the director, or at that time she was responsible for the program. So she goes, why don't you set up, a time to talk to her? I had no idea what applied behavior analysis was. I was like, I don't know what this is. And at the time they were just taking anyone. They were just taking anyone.
Yep.
I always go for the programs where they're just like desperate and we'll take anybody, and there's like no requirements. I'm like, give me the one with no requirements, because like that's what I need. But it all worked out because they were just taking anybody. Because like I said at the onset, the program was relatively new.
Sure.
So they were not, they would take anybody who wanted to try it. Yep. So I was like, sure, this is the only thing that I'm probably going to get into. Right. So I go set up a meeting with her, and there was like no requirements. I think I remember to get into the program besides like just be a real human and a decent person and show up. Yeah. And I think she maybe had remembered, like, known my father or something from autism advocacy, because she is responsible for a lot of the work in Michigan for autism advocacy. And basically, long story short, I was in the program, and from day one, I was like, holy shit, this is the coolest thing I've ever done. The first class I remember, it was about defining behavior. And I sat in the front row, by the way. All the other classes I've ever been in, I sat in the back, like messed around on my laptop, on my phone. Like I didn't take it seriously. I'd like try to leave. I'd like leave and go to the bathroom, but like come back 30 minutes later. Yep. Like, and so I was like a menace. But this class, I sat in the front row, and I don't know why I did that first day. I sat in the front row, and I just remember the very first PowerPoint, the very first slide. I was like, holy shit, this is the coolest thing I've ever heard. This is it. Yeah. And I couldn't get enough. And it was about like just understanding behavior and defining behavior, and then changing behavior, predicting behavior. And the thing about it, because I had taken mind you, I took psychology courses, right? Yep. But the thing about it that was so different is that it was data driven, and it was based on like observable, measurable data. Yep. And the thing that bugged me about other areas and other domains of psychology, like I loved it all. And I would read so much philosophical and theoretical workings on, Carl Jung and all these other psychologists and philosophers, but it was all just a lot of talk. There wasn't like doing. Yeah. Right. And this is an important point in the story, because that's what makes it different. And sport is very performance-based and very driven and data-driven, not to mention. Yes. So I love these stats. I love the stats. And I love stats. But by the way, side note, we'll talk about that maybe later, but I don't love when coaches are just strictly stat-driven. So that's a whole other story. But it was a lot of talking about the thing and the problem and not doing anything about it. And actually, one of the NHL referees that I'm working with right now, he had heard me on Jeff Merrick's podcast, and he said, like, what I liked is that you mentioned that it's about doing and behavior change, not just talking about the thing. Because, he had mentioned, and like a lot of people do, that he had tried other forms of therapy before and other forms of psychology, but it was a lot of talking, and that's really, it's difficult, right? So that's what really got me hooked, is I was like, this is so cool, because it's based on data. I can see the change. I can understand. I can manipulate the variables in the environment and understand where the change came from. And every single class I did well. I did so well. I remember, I think, I did really well. I graduated with honors. And I was just like, what do you know? And I was academically dismissed like a few years before, and I studied hard. I could regurgitate the information really well. Like before, I'm not gonna lie, maybe I cheated a little bit sometimes in classes, and I like look at a piece of paper, but like this, it was so me. I couldn't get enough. And I remember just asking questions a lot. I always raised my hand. They were so like, Alicia, you have another question? I was like, yes, I have so many. let's go. I was dialed in. So I loved it. And then there was one project that I did, and towards the end of this program, it's a 2-year program, and there was one project that I did that we had to do a functional analysis on a behavior. And the functional analysis is where you, just long story short, it's where there's a lot more to it, but I'm just going to summarize it. It's where you basically manipulate the variables in different conditions to determine what's maintaining the behavior, right? And so I did mine on something completely different that most people didn't do. Like maybe they would do if they had children. Some people in my program had children, because at this point it was 2018, 16, 17, 18, 2018, was it? 16. 2016, 2018. I forgot what year I graduated. Yeah, anyway. And so, maybe they did it on like thumb sucking of their little baby, or they did it on like nail biting. I did mine on my brother, who at the time was engaging in still does sometimes, engages in self-injurious behavior. And I remember after that presentation, Krista, she, pulled me aside, talked to me about it, because it was very different. But for me, it was, but also just to make sure like I was okay, because there was a history of
Yep.
that came because of this. And I remember the thing about that is that it also tied to my dissertation later on in my PhD program. So yeah, it was 2018, graduated the program, then immediately went on again to another, because school wasn't enough then. I had already been to like 6 different universities.
I was going to say.
Yeah. So then I'm almost done, I promise. So, but I've never really explained this ever anywhere. And
Yeah.
everyone always asks. And I'm like, okay, well, working in hockey, like this is how I got to where I am. So sorry,
Yeah.
Nick, but you have to be the one for the
No, I'm just amazed by the number of different schools along the way.
Yeah, well, okay. So from there, so I graduated and then immediately started right into the PhD program. And I did my PhD at the Chicago School of Professional Psychology. It was 2018, because the PhD program took me 5 years.
Wow.
So 12 years of school, more than 12 years, not including high school, but I don't include that. But 12 years of school, and my PhD program, I also want to say that I wouldn't have done it had I not loved ABA so much.
Right.
But I loved it so much. I was obsessed, and I was like, I want to know everything there is to know about this. I want to discover something. Like, I was like, I want to be like, it was amazing. Right. And, so a PhD program, oh, you know what? I forgot this too. So actually the first 2 years of the PhD program went well. There were 2 classes that did not go well. They were really tough, and truthfully, I think I had an instructor, if I recall correctly, wasn't the best instructor, and it was tough. I was academically dismissed in the middle of that program.
What?
Yeah, so a second academic dismissal. So yeah, no one would really like guess this. Maybe I shouldn't be telling everybody this, but no, it's okay. It's important because context matters, and also I think that you can go through things, and sometimes actually that academic dismissal was really important for me, because I needed a break. And so what happened was I was academically dismissed because I had taken the same class twice and I still did not pass it. But it was a really tough class, and I also it was just before COVID, and
Yep.
it was like COVID was just hitting, actually.
Yep.
And I was, as anybody, I think a lot of people, their life just kind of spiraled a bit. And so that's what was going on then. Now, during that whole year, though, they said take a year off, or you're academically dismissed. You have to reapply. They didn't say take the year off. They said you're academically dismissed.
Yes, yeah. It wasn't a vacation.
Yeah, exactly. But I was very close with the program director, and still am and stuff, and my professors. They all knew what was going on. They were all very supportive of me, and they knew, just like with everything going on. And I said, I want to stay active this year, though, before before I reapply, so that that I need to come back and I want to come back. And they were all very, very helpful with that. I worked on some research projects during that year with some faculty. I did everything I could to still stay engaged. But honestly, that year, it was like a year of a break I needed.
Yeah.
And so, because 5 years too, if you think about it, I never actually even had a break out of all those 12 years. So the way I saw it was like, I know that they know I'm capable. It was just, I think I was just burnt out. Right. And so, I come back and I finished the program, with also honors, I think, in that in there too. So that was nice. And also my dissertation, my research project took 2 years to complete. Because in a PhD program, everybody will do a dissertation, right? That's the main focus of your studies.
Yep.
And so the switch that kind of helped me transition from autism to hockey and sport, it had to do with the dissertation topic. But I do want to say really quickly before I get to that part, when we wrap this part up, is that the whole along the way during my PhD, right? For those 5 years, because it was a program online, we did have to go do a residency in Chicago, but most of it was online. I was working all this time in different clinics. So with children with autism, individuals with autism, not even just children, but adults with autism and neuro developmental disabilities. And I was in some of the most recognized clinics of for applied behavior analysis. So I was at University of Nebraska Medical Center in their pediatric feeding program. And it's not just feeding. It's like you see the most severe cases, like patients that are 100% tube dependent, that can't swallow, can't eat. They are malnourished because they're not taking anything in. They constantly regurgitate food. Maybe they engage in pica, so they chew on maybe like metal objects or nails or things that are not edible, and they put themselves in great harm because of this. So I was really entrenched in seeing some of the most complex cases. And shadowing and learning from researchers and other BCBAs who do amazing, great work in this area. And then I was in the DMV area in Baltimore at Johns Hopkins Hospital and Kennedy Krieger Institute. And Kennedy Krieger, the neurobehavioral unit there, I was there for about a year, and you see the most intense, complex cases, like the top 10% of severe behavior, like head banging, eye poking to the point where maybe they go blind, self-injurious behavior of biting their fingers to the point where they bite to the bone. These patients, they are very aggressive sometimes. So maybe, you're in a padded room, you might get concussed, they might get concussed, excuse me. So these are all behaviors that they engage in because, the reason that's different, but it's really the most severe cases, and seeing these complex cases, like rare conditions, right? Rare situations of behavior, or examples of behavior, I'm sorry. And it really gave me a very thorough understanding of behavior. And so some of the most complex behavior for a neurotypical individual like myself or you or some of the hockey players I work with is verbal behavior. So the things that they're saying and the way they're talking to themselves. And because there's such a long history there. And so I think that my time in these places really helped me to understand contingencies of behavior and complex behavior to a degree that helps me to be successful with athletes, because especially with hockey, as you know, it's so fast. The game happens so quickly. That is very, very complex to break down the variables and the latency between the time in which one shift, his skate touches the ice for a shift, to the time that his puck touches a stick, to the time something like there's so much happening, right? And so it's very complex because there's a lot of behavior happening in a very short period of time. Now, this is just on ice. Then we talk about off ice stuff. Right. And so it's really complex. So these, I know, again, it's very long-winded here, the whole history, but it's important because I was exposed to really complex behaviors and situations that I don't think I'd be as successful now if I had not been put in those situations. So, I graduated with my PhD. My PhD my dissertation topic was on the correspondence between self-descriptions and heart rate. Now, if we think about that with hockey players, right, how they're describing themselves and how does their heart rate, how are those two related? And especially with recovery from shift to shift, if you want your heart rate down for the next shift for your first 3 strides to be explosive or what have you, well, how are you talking to yourself? Are you being self-critical? And what's the relationship to that, to your heart rate? So I had no idea at the time I was not applying it to athletes at that time. I actually applied it to just general population, BCBAs and working moms, actually. And then I took that research and then applied it to hockey players. Interesting. So after I've graduated, all was well. Basically continued to work in the hospital setting, the clinical setting. Left Johns Hopkins, COVID had hit. wrapped it up, I worked at a clinic in Boston, and I was at that time, like COVID was still going on. So everybody, I was just like, I was getting burnt out with autism. And it was also too, I was really sick of dealing with insurance companies and not being able to help individuals with autism the way I wanted to. It was very depressing. It broke my heart, like knowing that these patients and their families needed this care that insurance was not approving. The bureaucracy of the hospital systems and the healthcare, I was just so done with it. And so then there was the transition to sport, which wasn't super clear, but basically that's all of the schooling. So I want to just stop there for a second, because I know that's a lot. I've done a lot of talking, so I'm so sorry. But that was it. I graduated and I finally made it through school.
Finally, only two strikes there, but no, I think that's super interesting to hear kind of the path there, because like you said, whether it's you, me, whoever, I think people look at different roles and think, oh, it was straight and narrow. They got there in one step. They knew exactly what school they were going to, what program they were going to. They're
That was
living
not
in
the
this
case.
city. Like, I think it's not the case for many people, right? Like, I always make the joke or the reference on here that, like, Wayne Gretzky was not a good NHL coach. He's the best player ever. He's not a good NHL coach. It's
That's a good
different
point.
journeys. People respond to things differently, and no two paths or perspectives are the same there. So no, I think that's fascinating to walk through there. And you teased the kind of education versus experience. Anybody listening is laughing because I ask this all the time, but I think it's very interesting in career paths, in sports jobs, the balance of education and experience. You've had a lot of education at a lot of different colleges along the way, and you have a lot of years of experience under your belt, whether that's working with athletes or the general population, like you said. How do you today, in what you're doing, look at or balance the education, the things that you learned in school, in the classroom, your research, versus what you're doing out in the field, what you see day to day, how you can relate that to others?
Yeah. So if I'm understanding your question correctly, how I balance the two, as you
Yeah,
were saying?
how you look at it. Yeah.
Yeah. So you're right in that I have a lot of education, and I have a lot of experience, and a lot of 10 plus years of experience with autism and neurodevelopmental disabilities. My experience now with hockey is 4 years. So, which is, I think it's a bit of quality over quantity. Like, what are you doing in those 4 years? So if people only knew what I do when I'm not in session with clients, like I'm watching hockey all the time. I'm listening to hockey. Like I'm listening to hockey podcasts. I try to listen to almost every team availabilities, media from the coaches to see how they're talking about hockey. What are they saying? And even though sometimes I know most of the time they're just giving generic answers to media, but I still listen, because that's also been very interesting. Like I'm like, God, they all say that. I could predict. I say it with them sometimes
I
out
love
loud.
it.
I'm like, I know
I
everything.
watch them all the time. I love it because you know
You
exactly
know
what is
exactly.
coming.
We have to
Yeah.
follow our systems. We get the puck. And like, okay.
They're a really good team. We're
They're a
going to have
really
to
good
stick to our
team.
systems tonight.
They're a skating team. We got to we got to win those puck battles. I'm like, okay. So I got the gist of that.
Yep.
Yeah. So my education, like I said, it's interesting because the experience. Education is one thing, but I think it's more so the experience of all of the places that I've been, that I've trained, and the behaviors that I've seen. And not just the behaviors I've seen, more importantly, how I saw the people before me, the people I learned from. I learned from some of the most brilliant minds in behavior analysis, and I watched them and just chat. Some of them don't even realize they had an impact on me, because I would just be this like little like student in the background, like observing, and to watch the way they thought and the way they analyzed. They would think out loud, right? So we like dissect a graph and the data, and to hear what they would say. Well, did you consider this? Did you consider that? And to see how they thought about behaviors. That experience, I think, has more of an impact than anything on me. And so taking definitely my education, because everything has to be based on the research.
It's a foundation.
It's absolutely. Like I always go back to, is what I'm doing or what I'm going to prescribe this client or tell him to do before this game or whatever, is it based on any research? In because you want to make sure it could be based on research too, but it could be maybe doing more harm than good for the particular individual, the particular player. Because also I have a lot of training in learning in contextual behavioral science. So the context matters, and context is very different for everybody, right? And so I think it's the experience, because I was very fortunate where, when I was at University of Nebraska Medical Center, I didn't live there. I flew every week for 4 months. Once a week, I would fly because I specifically wanted to learn from this researcher there. And I said, will you please take me? She came to Michigan to do a presentation. And I went up to her after and I said, her name is Dr. Piazza. And I said, I would really love to learn from you. Like, can I come do my requirements, my hours, my requirements with you, my field experience? And she said, well, sure. But like, are you going to, I said, no, I'll fly back and forth every week to come to clinic. So I flew every Sunday night. I would fly out my mom worked for Delta. So I was lucky in that I flew for free. Otherwise, I don't think that would have happened.
Right.
But I still was like paying for staying in the hotel every week. That was wild. But like only a handful not a handful. Let me say this. It's not the majority of BCBAs who get to learn from her or learn from some of the researchers in the BCBAs that I learned from and observed when I was at Johns Hopkins, right? So that experience really matters. And then the first 2 years of working with hockey players, I just absorbed, I still to this day absorb everything I can. I go back and rewatch like every Zoom session we've ever had. I re-listen to every conversation. I watch their games. I look at what they wrote in their notes, and I really absorb how they speak about their game and about as a player mentally, like what are they experiencing and how are they talking to themselves? Because verbal behavior is behavior. So if I clap my hands, that's a behavior, right? So we think of behavior often as just the things that we can see. But behavior, thoughts and feelings, thoughts, emotions, and how we talk to ourselves, those are behaviors as well. They're just unobservable behaviors. So now my specialty and what I specialize in is those unobservable behaviors, because that's also what part of my dissertation was on. And they're called private event. We refer to them as private events in behavior analysis. But verbal behavior and private events, like that's my jam. Like I love it because that's so much of what takes up our headspace,
100%.
right? And when we talk about the mental aspect of the game, like that's it. And so, also I think personal experience. I did a lot of reading from other areas and domains that are outside of behavior analysis and really just try to learn a lot. So a long-winded way of answering your question, but it's both, but I think experience is everything.
Yeah.
Now,
I think that's interesting.
Really quickly, I want to say though, if you're going to do something, you should have the education and the background to do it. And this is also like just a little caveat here, I get a little irked when I see sometimes on socials when like strength and conditioning coaches or and again, I think most people are well-intended and they want to just help. And I understand that, but we have to be very careful when if it's not your domain or you're not your area, if you're stepping outside your lane and if you're a strength and conditioning coach or a skills coach or what have you, and you're posting about like thoughts or the mental aspect of the game, it doesn't really fit. Like I don't post about strength and conditioning. Now I post myself golfing, which is not my area of expertise. And I do post myself like working out sometimes. I'll be because I'm tough, but I'm not that tough. But it's really important to like stay in your lane. And I understand wanting to share maybe something that might have been helpful for you, but to declare it as truth or to declare it as like, just like, don't listen to your thoughts. Your thoughts become things. It's like, that's not true for everybody. Like some people have anxious, so I don't want to go off on a tangent there, but it's important to have both. It's important to have both and just make sure you're properly credentialed is what I'll say.
I totally agree. I think that that's a great way to look at it. And it's interesting hearing you talk kind of just about the relationships with the players and how it works there. So I'd love to learn a little bit more about logistical side of how you work with players today. What sort of communication cadences do you have with players? How many touch points are, like I think you mentioned shooting over notes pregame or postgame to check in on how they're doing. How do players find you? When do players know that they need you? And how do you work with them now?
Okay, so it's a good question. If it's okay if I tell you a bit about how the transition went
100%,
because that will explain how they find me. Because everyone's always like, well, how did you make the jump? Like, where did you come? Someone was like, did you ever play hockey? I was like, no, the most I've got is I'm from Detroit, so it's hockey town, right? But like that doesn't really do much for me. So it was kind of a blur and like two things kind of happened. I didn't notice it was happening as it was happening, this transition from like players finding me. I don't know if it's so much players found me as I like shoved myself into their faces via the algorithm, right?
Yeah.
So like I said, in 2021, COVID stuff was still going on, and I made the decision. I moved. I was in Boston, and I kept trying to figure out, like, this autism thing and working in clinics is just, I'm getting really burnt out by it. And I don't see myself working for anybody. I was like, I'm going to open up my own clinic. But I also didn't want to open up my own clinic at the same time because there's like so much that goes into that. And I wanted to sort of have some freedom. Right. I mean, I spent 12 plus years in school being anything but free.
Yep.
Okay. And I was like exhausted and just like, this doesn't seem like this is it. And I kept saying, I know that I definitely want to keep using what I do, like behavior analysis, but with autism, like, this just might not be. In the law, some of the laws were changing, making it even more difficult to get coverage. And I just didn't want to deal with that. And I knew whatever I did, I wanted to be able to charge, like, pay out of pocket. Because I just was like, also too, you got to think like student loans. Like, I was like, I need to make money and I need to make money quick. And and so I started my own LLC. At the same time, I was like working at a clinic, but the LLC wasn't, I don't know. I took it seriously, but I also was just posting content to post content on Instagram. And I was posting content related to like contextual behavioral science and something called acceptance and commitment therapy. And so it was really for the general population, for anybody who maybe struggled with anxiety or depression or relationship attachment styles, anything, right? So I was taking up behavior analysis and I was applying it to the whole inner healing space we see on Instagram, for lack of better words. Okay. You get what I'm saying, right?
I get it all the time on my feed.
Okay. Oh, well, maybe we should have a little chat later. I'm just kidding. So I was taking behavior analysis and saying, like, okay, if you're saying you have attachment issues or attachment style, you're anxious attached or securely attached, what is that as a behavior, right? And so I was really breaking it down in this way, and I started to just keep posting more, at the same time still working, for this clinic in Boston, and trying to leave the clinic, by the way, or just figure out what I was going to do. And then it's kind of a blur right now, but I was posting and getting some traction with the general population with this content. And then I posted one reel about negative self-talk. And I don't know how, but a couple of hockey players at MSU had started following me. I think maybe just the algorithm of like being near each other when I was like back in Michigan and stuff. I'm not quite sure. And Carson Dorwart, he had messaged me and he watched the reel, him and some other players, and he was like, hey, this was really helpful. And so I was like, oh, that kind of, just him saying that, I was like, oh, wait, I could keep doing this. But the thing about the general population is, like, you have to pull teeth to get people to change, right? Yes. Whereas athletes, they want the change. They want
any edge possible.
Any edge, exactly. And so even just by them messaging me that, I was like, oh, wait, what if I got more specific and more niche specific with the population of people that I work with? And so I started posting more content related to sport, but specifically hockey. And then I was still at the same time, like, trying to, because you're not making any money then, you're just posting. And so I was at the same time still trying to be like, okay, well, I need to make money and I need to get something going here, so I can't completely leave the clinic, but I also need to go like all in on this content thing, right? And I'm sure like as a content creator yourself, it's a whole nother world. Like, you got to learn everything, right? And so I never learned anything about that in the 12 years of school, funny enough.
Didn't come up in a course.
No, there was no course. Not even the ones that I just they just let me into it. Yeah. And also it's wild because it wasn't really even a thing then,
Right.
So, so then I remember I was like, I need to go all in on this content thing. And I had hired somebody. I paid her a large lump sum. Well, my father did, actually. I paid him back. but it's just to teach me about content creation and understanding like Kajabi, understanding WordPress, understanding the algorithm,
Yep.
understanding like the things that would get your content reach and engagement. And I'm like, shit, this is a whole thing. And so I kept posting more and decided, I ended up like, I wasn't at the clinic anymore. And I'm like, all right. Then I kept trying to find like more clinic jobs and nobody would take me either. They mostly said I was overqualified, which I was for some of these like autism clinics in Michigan.
Right.
And I was like, I was like, but I need something. But then it finally just like hit me one day where I kept getting coaches reaching out and players reaching out, the more content I kept making, where I said, I was like, Alicia, like in my head, I was like, it's just right in front of you. Like, just go all in on this like hockey thing. And so I did. I was like, you know what? Screw it. And I just went all in on creating a bunch of content. And one day, the one that went viral, it was so weird because it was like this one I just randomly, I pulled over to the side of the road. I was so frustrated with like this, hearing the same thing from two players in one session one day, that I pulled over to the side of the road. I made this like reel about your self-perception being tied to your performance and how I was so sick of watching them beat themselves up, and it went viral. And then a few reels afterward went viral as well. Now, at the same time though, I had taken a trip like down to Florida, and I remember while this was also happening, like they kind of like just happened at the same time, right? It wasn't like one thing caused the other. It was just like this happened at the same time. I had taken a trip down to Florida. I was flying back. I was sitting next to somebody on the plane. We got to talking and he said, the hockey world could really use what you do. Cause I was flying back from Tampa and he had something to do with like a minor league there. Like it was like a junior hockey team, minor league with baseball. It was, well, it was spring training, I think, but he had to do with hockey and it was like a junior team down there. And so he said hockey could really use what you do. And he put me in touch with a player and then we started working together as well. And so these two things were kind of happening at the same time. And then that's where I was like, I just need to go all in. So I went all in, and when I saw like money, I started making money. I was like, oh shit, this is cool. And the other thing about players is like, for the NHL guys, they have contracts, they have the money to pay. And then so it's not like the general population where you have to pull teeth to get them to pay for a service. You don't have to deal with insurance. And then, I know with junior hockey players and stuff, they don't like, but there's parents, some who can pay. I understand that it's very fine. Hockey's expensive. I understand. Yep. But I also am like, a doctorate degree is also expensive. So we also understand that like, and then the experience and the value there. So that's where that transition came from then I started cold DMing players and I would say, hey, do you want to work with me? And interesting. Yeah, it's funny because I was like, this could go one of two ways. Either they're going to be like, who's this chick DMing me? That's like, because, there's like younger dudes and you're like, but I was like, I want them to take me very seriously and I want to help. Yep. And so to my surprise, I was very happy that many of them were like, heck yeah, like, let's go. So that was very cool. So I would cold DM them. And then from there, like they would tell their agents like, hey, I started working with this Dr. Naser. And then that agent would be like, who's this? And they'd look me up and then they'd maybe refer some of the other players in their agency to me. So getting to your question now about how do the players find me, a lot of it now is word of mouth. Yep. I've never done a sales page. I've never had any sales page or anything, which is great. Yep. This is the best part about all of this is like, I just get on Instagram and I talk and I'm myself, and that, like, I guess that plus the experience, back to your point, sells itself, right? And then also I have this proof from all of the players I've worked with so far, which 100%. The ones I've posted, just the ones I posted about the testimonials, that's just a handful. There's like a whole bunch that, I just don't post about. Yeah. And so this is how players find me, is word of mouth, through their agents, on socials, hearing like a few NHL refs have heard me on podcasts. Really, it's that. So they'll reach out, they'll fill out an application, their agent will reach out on their behalf, they'll DM me, and usually it's like, hey, I saw you work with so-and-so, or hey, like they just are like, hey, I want to work with you. Like I get it now, right? And so that's how that comes to fruition. Does that answer your question there? And then I know you want to know about like, what do we work on?
No, I think that's awesome because I say it again, almost every single episode on here. And I'm sure there's better ways to frame it, but if you're doing cool shit, you have to tell people about it. You have to post it, right? Whether that's a graphic designer, they have to put their stuff out there to get seen. Whether that's what you're doing, if you weren't posting those videos of you talking about the self-awareness and self-talk, maybe players wouldn't have seen it. And then how do you get those first couple? The social media element, I know a lot of traditional businesses and career paths still roll their eyes at it and stuff, but it just allows you to get the ball rolling in these different fields.
Yeah, it really does. And I found it's a great way to keep track of what I'm learning from them. And it's a
Yeah.
great way to keep track of like what we're talking about. But Nick, I don't know if you experience this. It's hard though, because some days you don't feel like showing up. Some days
100%.
you're like, screw this shit. Like I do not
100%.
want to. You're like, some days I'm like, I'm feeling a little depressed today, or I just don't feel like talking to anybody, or I look like hell, or I have nothing to talk about, like, and you just don't feel like showing up.
Yep.
But then I'm like, okay, shit, but it's my business. So it's
Yep.
like, but what I found is if you actually put that out there, like when I go on and I'm like, hey guys, I'm not feeling it lately.
It's relatable. It's real.
Absolutely. It's relatable. And people are like I get a lot of engagement, and they'll message me, respond to my story and be like, hey, like we get it. And that itself is content. What do you think?
100%. 100%. I think that's why people like social media, because it's showing us the real relatable side of people. Everybody has those days. And, when I post that, hey guys, it's hard to get a job in sports, the number of messages that I get, like, yeah, it is, dude. Like, thank you for what you're doing. Like, yes, it's hard. Yes, it's difficult. Like, I think what's on social media today compared to prior to COVID is real and relatable, and it's honest and it's open on these things. And that helps people understand that, things that you're doing are difficult too. And the perspective has changed through social media, I think.
Yeah. Yeah. It's kind of wild to think that all of this started just through a little phone, a little square app. It's really wild. Yep. But then also the scary part of that is, it's not so scary anymore because I've built it up to a point where now it's built up, but it happened very quickly. That's also the other thing is I think, a lot of times people are like, they message and they DM me and they're like, I want to do what you're doing. How do I do what you're doing? I'm like, listen, first of all, and we should maybe say this is, so I'm the first behavior analyst to work with pro athletes, like we said at the onset. Therefore, there's no blueprint. No one's done what I've done before. No. And that's a very exciting thing. It's very cool. But it's also, then there's nothing for me to reference. And so sometimes I get stuck and I'm like, okay, wait, what do I do now? And this is where like, I have to be super humble and be like, I don't know everything. No, I have to find people who know things that I don't know. And there's a lot that I don't know. There's so much that I don't know shit about, like about a lot of things. Like when you think like content and business and media stuff, right? Like all this jazz. It's like, even you're like, oh, you got a setup. I'm like, I got a mic. I know. So there's so much to it, but it's really the piece that I found so exciting is, I was teaching some courses in some at Wayne State. I've taught one course in foundations of applied behavior analysis. And it was like when the whole cancel culture thing became like a thing. Yeah. And I was like, I don't know if I love this and I want to teach. Like I love to teach so much. And what I found is that like I taught it and I loved the teaching, but I didn't love the idea of cancel culture lurking around. So I was like, I don't know. What if I don't want that to happen to me? But it was just one course. It didn't happen. But, it was just always there. Yep. And so then I found that social media is a way of teaching. And that's what I view it as, like a form of teaching. It's, for me, business, it's a way to attract leads. And then it's a form of teaching. Now, it's tough because the ROI, right? Your return on investment is... I've been lucky. So the return on investment, if you think for every couple of stories, if I get a few leads, awesome 100%. Players, right? But what's even better is that at least I was listening, was it Laz? He was on here and he said, it's not about how many people you know, it's about how many people know you.
100%.
Was that the line?
Yeah, that's his best line. That's his best line.
Okay, so but I hope he's proud that I heard that I remember. but it's true because the way I saw it was like, okay, well, even if they don't reach out to apply to work with me, at least they're seeing my content that's hopefully helping them. Yep. And then also now they at least know me, right? And so There'll be like a lot of agencies from like Cortex and stuff or whomever. And like the players are like, yeah, my agent knows you. I'm like, how? I don't know him. I'm like, but then it's like, so you never know who you're reaching. Sorry, we're digressing. I'm going off on tangent here,
No,
but
100%.
I think we were talking about like how players find me, the whole content piece. It was really like a learning curve. Now talking about experience and education more so. Like I said, I spent 12 years learning all about humans, behavior, and the brain, and psychology and neuroscience, but 0 hours of learning regarding content creation and running a business.
Yep.
So that's a whole nother thing too, and I think a lot of people, when it comes to working in hockey, want to know about how do I get into sports psychology.
Yep.
So maybe we should just.
That was next on my list here.
Okay.
Perfect.
Oh, okay. What was your question going to be?
Basically just that. I think people, there isn't a course or a program to get into sports psychology, right? There's psychology, there's behavioral. It's very rare or niche right now, obviously getting more popular, but how would you advise or suggest somebody to go about breaking into the world of sports psychology?
Yeah, so I don't know if there is a path or not directly in sports psychology. So we have to remember, I'm not a clinical psychologist, right? So
Yep.
I didn't go to school for psychology. I went for applied behavior analysis, which is a domain of psychology.
Yep.
It's behavioral psychology. So now I'm assuming, I haven't really even looked into this. And also, I'm glad we're doing this, but at the same time, I just need to say, when I was younger and when I was in school and trying to figure out what I wanted to do, and when I wanted to shadow certain people, I did my research before I reached out to them. I looked up the paths. So if a student or any individual, even like who was once I get a lot of players who maybe played college hockey and then they want to go into this and then they message me. Here's the deal. Number one, do your research before. Don't come to me and ask me, right? It's like, hey, I grinded out and figured it. Yeah, okay, you know what I'm saying?
Yep.
It's like I grinded it out, figured it out on my own. No one taught me. I went through so much crap and figured it out. And also, by the way, I did that years ago when ChatGPT didn't exist. And like, just Google it right now and figure it out before you come to me. Because then I'm more likely to take you on as a supervisee or a mentee because you're showing me you did some work. Number two, don't be lazy. Do the work. It's one Google search of like, how do I become a sports psychologist or a mental performance coach or whatever the case might be. That irks me. I get that a lot. And I'm just like, what is this? You just think someone's going to give you the answer. You have to like look it up. Right. Yep. And so that's important. Now for me, this is really an important point for everybody because I get a lot of questions on it. You have to remember like my path and what I'm doing is so different than somebody who says they are a sports psychologist. Okay. Because they probably went to school for psychology, clinical psychology. And then they probably maybe did some rotations or trainings or shadowed in sports.
Or played a sport through school, like you mentioned, right? And that's kind of their tie-in to...
Oh, yes. So, yeah, like you're saying a retired player.
Yeah, I feel like that's very popular. And like you mentioned, people kind of tie off their experience once they get that general or clinical degree.
Okay, yes. So, I feel it. So there's sports psychologists. Like if somebody says they're a sports psychologist, that should mean if they're ethically going about it in an ethical way, that they have a degree in psychology and they have the proper training for a background in sports psychology. I don't know what that is. That's for psychologists. I'm not a psychologist. Okay. So they have to look that up. So then there is my path, which was a degree in ABA, a PhD in ABA, and then specializing in behavioral sports psychology. Now, everything is behavior, so I essentially take the principles and the interventions and strategies we use, and I apply it to the behavior within the sport context that we're referring to, okay? I'm also doing a ton of my own outside, like continuing education and things like that on sports and related areas, but it's really mostly verbal behavior in the private events that I was mentioning before. Now, then sometimes online and socials and stuff, you'll see people who say they're mental performance coaches or they are mindset coaches or whatever. Okay, there's a lot of that. These taboo, like
gurus.
Not taboo. I'm sorry. These very like buzzwords, gurus. Yeah. Sure. Number one, just always look for credentials. Now, I'm not saying somebody has to be a doctorate. They don't have to be a doctor in a field. If they have a master's, that will suffice. They just have to have the proper training and credentials. There's a lot of, anybody can say, I'm a mental performance coach. But if you don't have the proper training and credentials, it can get tricky because then you're doing a disservice, and it can be unethical because you're essentially saying that you can help somebody, but you could be doing more harm than good.
Yep.
So this is really important. Now, somebody can have credentials too, but do they have a level of experience that you're looking for? That's also something to consider. Now, I think it just depends on basically the amount of time, energy you're willing to put in to understanding and training, and then the path you want to go down. All the other areas, I don't want to speak too much on them because they're not my area. So I don't want to get something wrong and then get some backlash or what have you. But what I would say is just you can look into academic programs that have maybe a specialization in sports psychology. Or if they are calling them mental performance, maybe, sure. I don't know if they really are. But the important part is that you have a really good understanding of psychology and a really good understanding of behavior. Because then I worry that if you don't, that you could be, again, like I said, doing a disservice to yourself, your reputation, but then also your clients, right? Or potential athletes that you want to help. Now, the other thing that's important that I get asked a lot about with hockey is why just hockey? Is it okay if we talk about that for a second?
Absolutely.
So I was at first going to just start and make content about everything, but that just felt too all over the place.
Yep.
And I'm somebody like, if I'm going to be great, I want to be great at something. I want to be really great. I want to be the best at whatever I'm doing. And like when I said about behavior analysis, where I was like, I want to just be the best at this, or I not like the best, but my best, the best I can be for myself. Yep. Okay. And so, with hockey, I was like, well, I have these players messaging me saying what I'm putting out's working. Let me just stay niche specific. Let me just stay niche specific with hockey. But then like some of my cousins, my uncle was like, my one cousin's like, well, what if you want to branch out? Like, that's not a good move. Like, I was like, but it's cyclical. Like, hockey will always be there.
Yep.
And I mean, the more I'm learning every day, it's like there's just more. There's never gonna not be a draft. So I'm always gonna have, leads out there, right, and clientele. And then the other thing, so I do work with some golfers and a couple of tennis players. I have tried other sports. And I just want to say that hockey is the best and hockey players are the best because I get bored. Okay. And also I'm very competitive and I'm very invested in the players I work with. And they're very competitive, as we know. Like, hockey players are just different. No one takes like a blade to like the face and goes back out for a shift. Right. And I'm like, hell yeah, let's go. Like, I love that. Other athletes don't do that. And I'm not saying that I look at them like they're not tough, but I'm like, come on, Yep. And so I think I have this appreciation now, since it's just been 4 years of really being in depth with hockey players, that I have this appreciation for their level of intensity and their level of competitiveness that in other sports I have not seen it. And I get bothered now when I don't see that. I'm like, why aren't you trying hard enough? Let's go.
Yeah. Yeah.
And I have found also that it helps a lot. This is something for anybody working in hockey to know, that it helps sell yourself when you can speak the lingo. So part of also too, like when I talk to parents or agents love it. Agents love when I start, like, they love it because, like, okay, you know your shit, right? Yeah. And so that helps. But it's also like, I don't want to not know what I'm talking about, but I know there's so much left in hockey for me to learn. Oh, you should see some of like my coaching friends and agent friends, and I'll be texting them all. What does this mean? What does that mean? What's about the ozone, the blue line, the neutral zone? They're like, and they just like, what question does she have again? I have a chat GPT strictly just for hockey terms.
Perfect. That's practice what you preach. Like you said, people got to go to chat GPT instead of DMing someone.
Yeah, exactly. Exactly.
Well, I think that's kind of all in terms of your journey, unless we missed anything along the way there. Anything else you wanted to add along the way to date?
No, I think I would just say those are a lot of considerations for people who are looking to work in hockey or do what I'm doing. I think if we want to just recap for anybody looking to get in sports psych or mental performance, is number one, just, make sure you have the proper credentials and training. Number two, experience and education both matter. Number three, I would say, put content out, because that is the deal these days. Like with anything, is put it out. Number four, don't try to be me, be yourself.
Yep.
Like, be yourself. I've seen some like other mental performance coaches that follow and like try to put, like, I can tell they're like repeating what I'm saying. And again, it's nice, flattering, but just be yourself. You got to just be
Yes.
yourself. A lot of times, like, listen, these guys are surrounded by a lot of people who just tell them what they want to hear.
Yep.
You just have to be yourself and be relatable. That's really important, and have a deep, and then the last thing is really have a deep passion and willingness to care about their playing career as much as they do, because they care a lot. And if you don't, like, they can sense it. And also, like, the more you care, the better it is for you, you know?
Yep.
And I mean, like, I watch so much hockey because I watch all of their games and I want to know what happens. I want to know what they're going through. And it's really important. So, I mean, I know that my approach is definitely probably different than, like, if you walk into like a therapy clinic who's like, we're mental performance coaches. Maybe they're not sitting there watching all their clients' games.
Yep.
And my approach is different, but my approach works for me right now. You know, it's growing. I'm growing definitely, but that will come. And it's just more so like I've built it. It's grown very quickly, rather quickly, much like, you reached out a year ago and now I'm like, wow. And so it really just be yourself and make sure that you have the proper training. Those are my two main takeaways for anybody looking to do this. And also, like, hockey players are just different. So make sure you're ready to work with them.
Yes, it's entirely different. But to circle back on two things you mentioned there, you're all in on it. I think that's one thing that, again, makes success and makes you stand out in an industry like this. And the second one you touched on is just being authentic and organic with everything that you do. Like, it's different when you watch all of your clients' games and can have those personal conversations and know what happened versus just being a number on a list or something like that. I think people see and gravitate again towards that authentic, organic nature, especially in the social media age that we are in. I had two other questions that take us a little bit away from your journey here that I wanted to get on.
Yeah, of course.
The first one is a little bit me pretending to know what I talk about here, but I think a lot of what we talked about touches on or bounces around self-awareness, perspective, perception. I hire a lot of people for my day job. I always say that self-awareness is one of the most important things I'm looking for in people, because I think it's very important in career path, knowing where you stand in a team, all those sorts of things. But I think it's something that's very hard to pull out of somebody or find in an interview or otherwise. How do you go about measuring, quantifying, looking at self-awareness in your clients? And is it as important as I'm making it sound to be?
It's a really great question. And don't let me forget this. I want to mention it because you asked a great question. And when you sent me the questions in the email about, do they always know what they need help with?
Yes, good call.
That relates to this. I was like, ooh, nice question. No one's ever asked me that. I think that the ability to receive information that holds up a mirror to show you a different side of yourself or aspect of yourself, players' ability to receive that with curiosity rather than resistance, to me indicates an ability to be self-aware.
Interesting.
I think that I don't want to say you can measure self-awareness based on doing a functional analysis of their verbal repertoire, how they report on themselves. Similar to how, I could say earlier, I said, before in the past, I wasn't my best self. I didn't know that then. I know it now. And I could really dissect a lot of things in the past for myself that I was, okay, so that's one aspect of, like, in retrospect, looking back on my behavior, what a player did, who they are, what they did. And then there's to say, this is a really important point for these guys on the ice. I'll say, in the moment when you lost that puck battle or when it hit the post and when it didn't go in, were you like, ah, shit, in your head? Or what were you thinking? Or I'll say, in the moment when you dumped that puck, like, were you aware of what you were doing? And then I'm like, why the fuck did you do that? And I'm just kidding. Okay. I'm just kidding. So, and it's the asking of a question that triggers them to think in a different way than they've thought. And they are pretty honest and very authentic and forthcoming with me. And they'll say, like, you know what? I think I knew I was doing, like, this is just an example. Maybe I think I knew that I was doing that, but I also know that I wouldn't have been proud that I did that, like that kind of a thing, right?
Yep.
So that, to me, is showing me they can try to be self-aware, and we're learning that skill. But when they come to, there's not much self-awareness, but they are very open to it as we
Right.
as we talk. So this is the thing I'll say. I'm so proud of them. I swear, I get so proud, and I know I say it all the time, but I am. But like, I'm so proud of all of my clients, and they have these all open and raw conversations, right? And they're wanting to work on whatever the behavior is, even if it's a verbal behavior, a thought, or what have you, an emotion,
Mhm.
or an execution, part of their systems on the ice. And so that's how I can tell that they're getting better at being self-aware. And then they'll come back and report on it in the next game and say, hey, that time I did that thing we talked about, now I see. I'm like, great. This is why you pay me the big bucks.
Right, right. So with that, with the kind of identifying or knowing what they need when they come to you, knowing the behaviors that they want to change versus kind of discovering them together, is the goal that players graduate, might be the wrong term, but graduate working with you? Is the
Yeah.
goal that they should be able to take what they've learned and be in a good spot and move on? Is there always those touch points, or again, kind of communications, or what is sort of the end goal when somebody comes to you?
Well, I always say it's a terrible business model because my job is to teach them to not need me. But
Yep,
the thing is, though, it's depending upon the life cycle of their career, there's always more to work on, and there's always
100%.
more to keep doing. And also the context is different because think about it. From game to game, their line mates might change, which means
Yep,
how they have to adapt their behavior um, based on the change in a lineup
yep,
matters. And it's happened. Actually, it's happened recently where we've had to be like, oh shit, like, okay, your line just changed. Now your line mates changed. So now we have to adapt what we're doing
sure.
based on your new line mates. And also now based on the team. And now, especially with the trade deadline, right? There
Right.
was just some minor changes this year. Okay. Just some minor ones.
Yep.
They were like, okay, so now the opponent, we have to rethink how, we're, so to answer your question, the end goal is to just improve the quality of their career, of who their well-being as players,
Right.
and to really kind of thin out as the intensity and the level that they need me. But I'm always there because I think, like Nathan McKinnon said in an interview, like, I will always be working with, he works with his sports psychologist. If I
Yep.
don't quote me on this, but I saw this interview and I remember him saying, I work with a sports psychologist and I'll always be working with her because if you're not getting better, you're getting worse.
Yep.
So I think if it's a general population, and for maybe somebody like yourself and somebody such as myself, we, last time I checked, don't have $1 million contracts. So maybe one day, Nick, maybe one
Not
day,
quite.
maybe one day. And so I think that there's also, somebody doesn't own our rights and that kind of a thing. So there's not so much at stake where like we have to always be on, we always have to have the edge or be working to get better. But these guys are different. They just always want the edge. And I don't blame them because there's no league like the NHL. So, um, I hope that answers your question. And I want to
Yep.
say really quickly, you asked me about how important is self-awareness. And I think that it's important. Ironically, I don't think it's everything, or surprisingly, I don't think it's everything because I know how to change behavior even if a player is not self-aware. There You don't necessarily have to be self-aware. You just have to set up the variables in the environment to change the behavior. So this is a whole other thing in a behavior analysis I won't get into right now. But I think it's better if a player is self-aware. You can only be better from that. Now, sometimes being a little too self-aware can
Can
actually,
hold you back.
sometimes we just need to be like, dude, fucking let it go.
Yep.
Like, it's all
Yep.
good, like, and so there's something to be said about that. And I'm somebody, like any of the guys will tell you, like, I'm very much like, we don't need to always focus on that. Like, yeah, I get it's a barrier, but it's cool. Like, let's just let it be what it is. Like, yeah, you're hard on yourself. I don't blame you. You should be. You were
Yep.
drafted in the NHL. You're playing in the NHL right now. You should be hard on yourself. So I think, it's really just about being more realistic and rational than it is. So yeah, to answer your question, self-awareness, I think is things can be made better by it, but it's not an end all be all. Cause think about it, a lot of them made it this far without being entirely self-aware.
Yeah. Absolutely. Absolutely. No, I think that's well said. And Alicia, this has been awesome. I can't thank you enough for the time here. I've got one last one looking forward to here since we looked back through your career and everything that you've done to date. Where do you see behavioral analysis, behavioral psychology in sports going from here? We know we talked about you being the only one, we believe, today working in professional sports. Do we think that is increasingly common? Do we think sports psychology is increasingly common within teams? Is it more players seeking out assistance or communication on their own? You touched on staff, refs, coaches. Where will it go from here?
So I have no idea, but my hope is myself in the process right now of creating a path for other behavior analysts to learn from me and do what I'm doing. So I'm in the process of creating that path and making it a more of a concrete specialization and certification for a behavior analyst. I would love to see more individuals interested in this just go into applied behavior analysis in general. Just to understand, like to get, understand my background, just to go into applied behavior analysis and learn about behavior from a behavior analytics standpoint. I think that would be wonderful. And then from there, maybe you find something else you want to do, but maybe it's sport. That would be awesome. I would love to see, and there have been researchers who have done in behavior analytic research on stats within the NHL. There's something called delayed discounting. But I don't think they have not worked with NHL players in an applied setting. But for NHL or just any pro league to use behavior analytic resources and interventions in ways to optimize their performance, mental behavioral performance. Everything is behavior. So there's no one or nothing that doesn't become better from our expertise. But I mean, I'm biased.
Yes. That's okay. You're allowed to be. But like I say, this has been fantastic, Alicia. I think we touched on a lot of great advice, a lot of great insight into the industry, into working in the world of sports. Can't thank you enough for the time here. Tell everybody where they can find you and about potentially a podcast that's coming on your end as well.
Yeah. So Instagram is Dr. Alicia Naser. Although I just started throwing stuff up on TikTok,
Yep.
I think I'm starting to like that a little bit better because
boy.
Should I not?
I don't, but
okay,
I digress.
No, I want to hear, because here's the thing. The algorithm is really bothering me with Instagram. Or maybe it's just my content sucks lately.
It could be. Instagram, I like because it just feels a little bit more community-based. TikTok, to me, you follow somebody, you never see their stuff again. They push you things similar to it. They push you other areas saying, we think you'll like this. I follow a friend and I never see his content again. That's what I feel on TikTok.
Okay, so can I just say this and you tell me what you think? So everyone was like, you don't have a TikTok? And I was like, no, I didn't for a long time. Because I just, aside from the work aspect and it being a business, my business is I don't love social media. I like to just be engaged in human connection, right? But after the whole ban thing, and then when seeing how people were like in uproar because they're like, we made so much money, I'm like, oh, could I be monetizing this? So, and a lot of my cousins were like, Alicia, my little cousins were like, you could go viral on TikTok, your videos are great. And so I was like, okay, these little dorks, like, let me just. So we were sitting around during Four Nations, we were sitting around in the basement watching Four Nations, and I was with my cousins, and he's like, dude, just throw it up on TikTok. And I was like, okay. So I started throwing some of my reels, and immediately they just got a lot of views. But I think my style of my reels maybe is good for conducive to TikTok. Well. Yeah. But I just post and ghost. Like I follow Joe Rogan's whole post and ghost. Like I just post it, and I got like within like a week 5,000 people following. I was like, wow, this is more than I've ever gotten on Instagram. To your point though, Instagram is definitely more community based.
Yep.
And I do like that. And I'm not going to go anywhere. Like, so to answer your question, I'm on Instagram is Dr. Alicia Naser. Doctor is fully spelled out. And then my TikTok is Alicia Naser. But I've gotten already a lot of leads and players reaching out on TikTok too. So it's making me think it's not all for nothing.
No, I mean, that's where they're spending their time too. So it makes sense, I guess.
Yeah. So there, and then for coaches, and agents, on LinkedIn, I have about, I think 1,500 subscribers now to Blades in Behavior, my newsletter, bi-weekly. And it's behavior analytic strategies and interventions for coaching strategies and front office admin staff stuff. So all of that is, you can go to my website and find links to all of this. My website's alicianaser.com or dralicianaser.com. It'll both pop up. And then Blades in Behavior is my podcast that is going to be coming out soon. Very soon. Probably in the next 2 weeks. Not probably, actually, in the next 2 weeks. And this will be one of the episodes up there, yeah?
100%.
Okay, this will be, and then I've been getting, there's a lot of requests for Nassar. So for my brother, so we're going to interview him on there. And then from there, Blades and Behavior, I was hesitant to name it that because I didn't want to just restrict myself to hockey. However, I think it'll gain some traction, and it'll be for coaches, players, parents, anybody who listens to like working in hockey, learning about hockey in this way. It'll be strategies, protocols, but also my clients, some NHL players on, having conversations, interviewing them. There's elements to their stories that I really want people to hear that they don't know about, so that'll be cool. And yeah, just a little bit of everything. So AliciaNaser.com, it'll take you to everything.
Awesome. Well, I'm excited for the podcast personally. I think this was a fabulous conversation. Can't thank you enough for the time. Dr. Alicia Naser, really appreciate it.
Thank you, Nick.